So we presented the results of the KARDINAL trial, which is the study of an investigational antisense oligonucleotide called Tonlamarsen. And we studied two dosing strategies. One was participants receiving a single dose and subsequent placebo, and the other was participants receiving 5 total doses. Now, it's important to note that this is an injectable medicine that we give subcutaneously, and you get every 30 days. And what we assessed was between group differences in serum angiotensinogen levels as well as office systolic blood pressure, because Tonlamarsen is a drug that suppresses hepatic angiotensinogen production. Well, I mean, I think that, when we look at hypertension, okay, all too often there's we just throw certain drugs at it. But we know that it's a very heterogeneous disease, and there's different populations that may benefit from certain therapies and not other therapies. What we looked at in the KARDINAL study was really, seeing, can we identify those patients that maybe their blood pressure is more driven by angiotensinogen? And that leads us to our next step studies, which is looking at this drug among patients with acute severe hypertension. Well, I mean, I think as I'm a preventive cardiologist, so we were talking about blood pressure, but then I also treat a lot of lipids. And what we know is that lower is better, lowest is best. And really the data from ACC suggests that lower long-term control of atherogenic lipoproteins like ApoB and the LDL cholesterol that they carry, it doesn't have any adverse effect. And if you want to save lives and prevent heart attacks, lower is better. Well, I think that there's been a constant push towards understanding what one's cardiovascular risk is, particularly starting at the primary care level and not waiting to the time where they've had an event or have to see a preventive cardiologist like myself. I think we know from now years of data, decades really, LDL cholesterol lower is better. Blood pressure lower is better. We have increasing data that treating obesity and losing weight is better. And so we want to understand one's risk and treat all those risk factors aggressively. And if we do that earlier, we're more likely to prevent strokes and heart attacks and heart failure.